Welcome to Senior Health Tips. Today I'm addressing one of the most common concerns men have, but rarely discuss openly: penis size and whether it can be naturally increased. I'm going to give you the honest, science based truth about what works, what doesn't, and what could actually be dangerous. The internet is flooded with miracle cures, expensive devices, and dangerous procedures promising dramatic penis enlargement. The male enhancement industry generates billions of dollars annually by preying on men's insecurities and lack of accurate information about sexual health. As a men's health specialist, I've seen too many men waste money on useless products, damage their health with dangerous methods, or destroy their confidence chasing unrealistic goals based on misleading information. Today, I'm cutting through the marketing hype and pseudoscience to give you evidence-based facts about penis anatomy, what can realistically be achieved naturally, and most importantly, how to improve sexual function and confidence regardless of size. This isn't about crushing dreams or selling false hope. It's about providing accurate information so you can make informed decisions about your sexual health and avoid potentially harmful approaches that could damage your function permanently. The reality is that sexual satisfaction and confidence depend much more on function, technique, and overall health than on size measurements. Understanding this truth can free you from anxiety and redirect your efforts toward improvements that actually enhance your sexual life. The anatomical reality of penis structure. Understanding penis anatomy is crucial for evaluating claims about enlargement methods and setting realistic expectations based on biological realities rather than marketing promises. Your penis consists of three main chambers: two corpora cavernosa that fill with blood during erections, and the corpus spongiosum that contains the urethra. These structures are surrounded by tough fibrous tissue called the tunica albuginea. The tunica albuginea is extremely strong and relatively inelastic, designed to contain blood under pressure during erections. This tough tissue layer is what limits natural expansion and makes dramatic size increases through non-surgical methods highly unlikely. Penis size is largely determined by genetics, similar to height or other physical characteristics. The growth that occurs during puberty results from hormonal changes that can't be replicated in adult men with normal hormone levels. Blood flow capacity, nerve sensitivity, and muscle tone affect function more significantly than chamber size. Many men with average or smaller dimensions have superior sexual function compared to those with larger measurements but poor circulation or health. The psychological component of size concerns often outweighs any physical limitations. Performance anxiety and confidence issues related to size can impair function far more than actual measurements affect sexual satisfaction. Understanding these anatomical realities helps set appropriate expectations and focus efforts on improvements that are actually achievable and beneficial for sexual health and satisfaction. Methods that don't work. Exposing common scams. The male enhancement industry is filled with products and methods that not only fail to provide results, but can actually damage your health and sexual function permanently. Pills and supplements. The empty promise. No oral supplement or pill can increase penis size. While some supplements may improve blood flow and sexual function, none can alter the fundamental anatomy or size of your penis. Many male enhancement pills contain undisclosed pharmaceutical ingredients that can be dangerous, especially for men taking blood pressure medications or those with heart conditions. The herbal supplements marketed for enlargement often contain synthetic drugs that aren't listed on labels, creating serious health risks and potential dangerous interactions with prescribed medications. Testimonials and before and after photos used to market these products are typically fake, created using photo manipulation or paid actors rather than actual customers. The temporary effects some men report from certain supplements relate to improved blood flow and confidence rather than actual size increases, effects that disappear when supplementation stops. Save your money and protect your health by avoiding all pills or supplements that claim to increase penis size, as none have scientific evidence supporting their effectiveness for this purpose. Saber. Devices and gadgets. The mechanical dangers. Penis pumps, extenders, weights, and other mechanical devices marketed for enlargement range from ineffective to potentially dangerous, with little to no scientific support for size increase claims. Vacuum pumps can provide temporary engorgement but no permanent size changes. Excessive use can damage blood vessels, cause scarring, and impair natural erectile function permanently. Penis extenders and traction devices claim to stretch tissues for permanent gains, but prolonged use can cause nerve damage, scarring, and decreased sensitivity that impairs sexual function. Hanging weights from the penis is extremely dangerous and can cause severe injury, including nerve damage, blood vessel rupture, and permanent erectile dysfunction. The minimal size increases sometimes reported with these devices often reflect temporary swelling or measurement errors, rather than actual permanent enlargement of penile tissues. The risks of injury and permanent functional damage far outweigh any theoretical benefits, making mechanical enlargement devices inadvisable for men concerned about their sexual health. Topical creams and gels. Absorption impossibility. Creams, gels, and oils claiming to enlarge the penis cannot penetrate deep enough to affect the internal structures that determine size, making their claims biologically impossible. Most topical products cause temporary irritation and swelling that might create the illusion of slight size increase, but this effect is temporary and potentially harmful to sensitive penile skin. Many contain allergens or irritants that can cause lasting damage to penile skin and tissues, potentially affecting sensitivity and sexual function long term. The cost of these products over time can be substantial, money that would be better invested in overall health improvements that actually enhance sexual function. No topical application can alter the tough fibrous tissues that determine penis size, making all such products ineffective regardless of their marketing claims or price. What actually works? Evidence-based approaches. While dramatic size increases aren't achievable naturally, several approaches can improve sexual function, confidence, and the appearance of size through legitimate biological mechanisms. 1. Improving blood flow for maximum function. Optimizing blood flow provides the most significant and realistic improvements in sexual function and can help you achieve your maximum potential size during erections. Cardiovascular exercise improves circulation throughout your body, including to your penis. Men with better cardiovascular fitness typically have stronger, fuller erections that maximize their natural size potential. The foods that improve circulation, leafy greens, pomegranates, watermelon, and dark chocolate, can enhance blood flow and improve erection quality, helping you achieve your best possible function. Eliminating smoking is crucial, as nicotine constricts blood vessels and can reduce erection quality significantly. Many men notice improved function within weeks of quitting smoking. Managing blood pressure through diet, exercise, and medical treatment when necessary ensures optimal blood flow for sexual function and overall health. Weight loss can improve circulation and may reveal more of your actual penis length by reducing the fat pad around the base that can obscure measurement and appearance. These circulation improvements provide real, measurable benefits for sexual function while supporting overall health rather than chasing unrealistic size goals. Pelvic floor, strengthening for enhanced function. Strengthening pelvic floor muscles provides legitimate improvements in sexual function and can enhance the firmness and sustainability of erections naturally. Kegel exercises for men strengthen the muscles that support erections and can improve both rigidity and control during sexual activity, enhancing performance and satisfaction. Strong pelvic floor muscles help trap blood in the penis during erections, potentially improving firmness and making your natural size more apparent during sexual activity. These exercises also improve ejaculatory control and may enhance orgasm intensity, providing functional benefits that matter more for sexual satisfaction than size measurements. Regular pelvic floor training can help prevent age-related decline in sexual function and may improve recovery between sexual encounters. The benefits of pelvic floor strengthening are well documented and achievable for most men with consistent practice over several weeks to months. Welcome to Senior Health Tips. If you're getting valuable, honest information about male enhancement and sexual health, please subscribe and hit the bell icon for more science-based men's health content for men over 50. What questions do you have about sexual health and function that you'd like addressed honestly? Have you fallen for any male enhancement scams in the past? Leave a comment below. Your experience might help other men avoid costly and dangerous mistakes. Memtorek. weight loss, and body composition. Losing excess weight, particularly around the midsection, can reveal more of your actual penis length and improve the appearance of size by reducing the fat pad that surrounds the base. Every 35 pounds of excess weight can hide approximately 1 inch of penis length, so significant weight loss can reveal size that was always there but obscured by body fat. Improved body composition enhances confidence and sexual performance, creating psychological benefits that often improve sexual satisfaction more than actual size measurements. Better physical fitness increases stamina and flexibility, enabling better sexual performance and positions that can enhance satisfaction for both partners regardless of size. Lower body fat percentages improve hormone production, particularly testosterone, which supports sexual function and overall masculine vitality that affects confidence and performance. Weight loss also improves circulation and reduces inflammation, both factors that enhance sexual function and help achieve maximum erection quality and size potential. Number spec: stress management and confidence building. Addressing performance anxiety and confidence issues often provides more dramatic improvements in sexual satisfaction than any physical changes, as psychological factors significantly affect function. Chronic stress elevates cortisol levels that suppress testosterone and can impair sexual function regardless of physical attributes, making stress management crucial for optimal performance. Meditation, deep breathing, and other relaxation techniques can reduce performance anxiety and improve sexual confidence, leading to better function and satisfaction. Communication with partners about preferences and concerns often reveals that size anxiety is largely misplaced, as most partners prioritize other aspects of sexual intimacy over measurements. Building overall life confidence through achievements, fitness, and personal growth often translates to improved sexual confidence and performance in ways that physical changes alone cannot provide. Professional counseling can help address deep-seated insecurities about sexual performance and body image that may be limiting satisfaction regardless of actual physical attributes. Setting appropriate expectations based on scientific evidence prevents disappointment and helps focus efforts on improvements that actually enhance sexual health and satisfaction. Genuine improvements in sexual function from natural methods typically become noticeable within 4 to 8 weeks of consistent implementation, but require ongoing maintenance to sustain benefits. Blood flow improvements from cardiovascular exercise and dietary changes can enhance erection quality relatively quickly, often within 2 to 4 weeks of lifestyle modifications. Pelvic floor strengthening requires 6 to 12 weeks of consistent exercise to show significant functional improvements, but the benefits can be substantial and long-lasting. Weight loss effects on apparent size depend on how much excess weight you're carrying, but even modest weight loss can provide noticeable improvements in appearance and function. The psychological benefits of taking action to improve sexual health often provide confidence boosts that enhance performance before physical changes become apparent. Certain sexual health concerns warrant professional medical evaluation rather than attempting to address them through self-treatment or natural methods alone. Erectile dysfunction that doesn't respond to lifestyle improvements may indicate underlying health conditions like diabetes, cardiovascular disease, or hormonal imbalances requiring medical treatment. Sudden changes in sexual function, penis appearance, or sensation could indicate medical conditions that need prompt evaluation and treatment by qualified healthcare providers. Body dysmorphic disorder related to penis size may require professional psychological counseling to address underlying issues that affect quality of life and relationships. If concerns about penis size are significantly affecting your relationships, self-esteem, or mental health, speaking with a counselor or therapist can provide valuable perspective and coping strategies. Men considering surgical options should consult with board-certified urologists who can provide honest assessments of risks, benefits, and realistic outcomes based on individual circumstances. While surgical penis enlargement procedures exist, they carry significant risks and often provide disappointing results that don't justify the dangers and costs involved. Surgical lengthening procedures typically provide minimal gains, usually 1 to 2 inches, when flaccid but little to no increase in erect length, while carrying risks of scarring, infection, and erectile dysfunction. Girth enhancement surgeries using fat injection or other materials often result in irregular appearance, loss of sensation, and potential complications requiring additional corrective procedures. The recovery time from penis surgery is extensive and can affect sexual function for months, with no guarantee that final results will meet expectations or improve satisfaction. Surgical complications can include permanent erectile dysfunction, loss of sensation, scarring, and deformity that makes sexual function worse than before the procedure. The cost of these procedures is substantial and typically not covered by insurance, making them expensive experiments with uncertain outcomes and significant risks. Sexual satisfaction depends far more on overall health, technique, communication, and emotional connection than on measurements, making functional improvements more valuable than size concerns. Good cardiovascular health, strong erections, and sexual stamina provide more satisfaction for both partners than size measurements that don't translate to better sexual experiences. Learning about anatomy, sexual techniques, and partner communication often provides dramatic improvements in sexual satisfaction without any physical changes to your body. Confidence, enthusiasm, and attention to your partner's needs and preferences typically matter far more for sexual satisfaction than physical attributes you cannot significantly change. Building overall health through proper nutrition, exercise, stress management, and medical care when needed provides the foundation for optimal sexual function throughout life. The energy and money spent worrying about penis size would be better invested in overall health and relationship skills that actually enhance sexual satisfaction and life quality. Accept what cannot be changed while focusing energy on improvements that actually enhance sexual health, function, and satisfaction for yourself and your partners. Develop realistic goals around sexual health, including better cardiovascular fitness, stronger erections, improved stamina, and enhanced confidence rather than pursuing impossible size changes. Invest in your overall health and well-being as the foundation for optimal sexual function, recognizing that sexual satisfaction is multifaceted and extends far beyond physical measurements. Consider speaking with healthcare providers about any legitimate concerns regarding sexual function, as many issues can be effectively addressed through proven medical treatments when appropriate. Remember that sexual satisfaction and relationship happiness depend on many factors that are within your control through lifestyle choices, communication skills, and overall health maintenance. The truth about natural penis enlargement is that dramatic size increases aren't achievable through safe methods, but significant improvements in sexual function, confidence, and satisfaction are definitely possible through evidence-based approaches. Focus your efforts on proven strategies that enhance your overall sexual health and function rather than chasing unrealistic goals that could waste money or damage your health. Your sexual well-being and confidence are too important to risk on unproven methods or fall victim to marketing scams that prey on natural insecurities about physical attributes.